Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Annavasotas Vyadhi and we have discussed Krumi Rog in last lecture. As I said, we have to consider this factor when a patient comes with the GI tract disturbance because of change lifestyle. First one, like sitting job, no exercise, which will increase the kapha dosh. And as I said in last episode, kapha dosh is a good medium to grow for the krumis, grow and survive. Hence, why this thought of krumi should be in your mind? Because of first, changing lifestyle like sedentary lifestyle. Secondly, eating of junk food or outside food. The habit is increased nowadays. Third one, low quality of pure water in India. Sometimes we get bore water mixed with the regular water, or sometimes there is no any purification plant, etc. So all these factors are responsible for the growth of the krumi. Hence, whenever a patient comes with any GI tract disturbance like Udarashul, Bhaktadvesh, Atisar, Chardi, the symptoms which are mentioned in the krumi room by Grantha, a patient comes with this disease along with other factors. Of course, you have to keep in mind that krumi can be one of the causative factor of these symptoms. Hence, as I told you in last lecture, there should be a habit of deworming by all of us, so the growth and further symptoms of the krumi can be controlled. Just like GI tract, in the text, the types of krumi, you will find Raktaja krumi. Now, Raktaja krumi is one of the factor, one type, and in the symptom you will find Vaivarnya also, Vaivarnya Kandu, the symptoms which are in relation with the skin disease. So, I will put in front of you my thought. If you agree, it's well. If you have your thoughts, you can share with me. In the Kushtha chapter or Shvitra chapter, you will find a reference of a krumi also, and hence, whenever a patient of skin disease comes to you, in that case, along with the Samprapti, Hetu, etc., what you will take the case, along with the other positive factors, in that case also, you should keep in mind the krumi as a causative factor. So, in last lecture, as I discussed with you, that when a GI tract problem is recurrent, I always give one deworming or krumigna dravya along with the other kalpa, whatever it is, kumikutha, etc., vidangarishta, what in the according to your faith. Similarly, in the Kushtha Vyadhi and Shvitra Vyadhi also, it is advisable along with other medicines of Kushtha and Vyadhi, just you should have a Kurmigna Dravya which will act on the skin. So, this is the other aspect other than GI tract I want to share with you. Now, in Balarog, there is Balagraha and there are different sizes of Graha they have mentioned. There is a one thought in the Vaidya Varga that all these Graha Badha are in today's era, we can interpret them as the krumi or as a viral or bacterial infections. In that time there was no microscope, so they don't have mentioned as a specific virus or bacteria, but there is a one thought that all these symptoms are very similar to the infectious diseases. So by Krumi, in generally we take as the Annosotus Vyadhi and the Krumi which uh, grow in the GI tract. But can we take Krumi as any type of infection, whether it is viral infection, bacterial infection, or particularly in the case of skin diseases, fungal infection? This is a thought in front of you, and along with the infection of the system, Annosotus, Mutrosotus, Pranosotus, along with the other medicines, shall we add the Kurmina Dravya which will act on that particular system according to the disease? So this is the thought I wanted to share with you, because when you say Krumi Rog, in general, we just keep in mind about the GI Annosotus, but in Kushtha Shvitra Vyadhi or any scalp infection like Indralupta also, you can consider Krumi as a causative factor, and you can give a treatment addition to the main Samprapti to as a safeguard. Similarly, infections of all the systems, in that case also, along with the symptoms, you can add Kurvina Dravya acting other which are have affinity or gamitva on that particular srotas or organ. So this is the other aspect of the Krumi I wanted to share with you. I will like your opinion on this, and in my practice I keep it in mind when treating such diseases, and this was the aim to share my practical implementation of Krumi with you. So as usual, we will take a Diwali break in the next week. I wish you all a very happy Diwali as well as a healthy and prosperous new year. Thank you very much.